All right, if you're a nurse or a student nurse and you've ever heard of the term nursing diagnosis, stop. Now, I know that some of you have had difficulties memorizing nursing diagnosis. Some of you are tired of it, or some of you don't even understand what it's all about. Now, I'm about to give you the cheat code to understanding nursing diagnosis, okay? So you're welcome. Now, the key to understanding nursing diagnosis, how to write it, is to understand your patient. Treat your patient as an individual rather than an object, rather than just a patient. That is, you need to understand them. You need to draw them closer to your heart. That is the reason why you're a nurse. Your practice is holistic. All right? Now, come with me. Now, in order to break down nursing diagnosis, there are three key things that are important in nursing diagnosis. The first one is the problem. The second one is what the problem is related to. And the third one is what is your evidence that that person is experiencing that problem. Now, let me explain. To give you an example, let's look here. This is an example. The example we see here is acute pain related to tissue injury as evidenced by verbal reports of pain and face grimacing. Now, this is a typical example of nursing diagnosis, right? Very good. Now, first of all, let's use this example to break it down. Whenever we're talking about the problem, we're talking about the diagnosis, the NANDA diagnosis. That is the patients. What exactly are you observing the patients suffering from? What did the patient tell you? All right. So when you're writing nursing diagnosis, the first thing that should come to your head is that, okay, you want to write nursing diagnosis, start with what the problem is. What is the problem? Hey, what is the problem? My chest is paining me. The problem is chest pain. But let's use this as an example. The problem here is what? Acute pain. Maybe the person had an accident. Acute pain. Now we come here again. Related to, when we're talking about related to, what is the problem related to? What is that acute pain related to? Now that's where you need to understand that related to talks about what is causing the pain that that person is experiencing. You ask yourself questions like, why is that pain occurring? Why is that problem happening? So the reason why that person is in pain is because the person has a tissue injury. Maybe they were stabbed. Maybe they experienced blunt trauma. All right. So the problem, what is happening to the patient? Acute pain. What is the cause? That's related to what? Related to acute pain related to tissue injury. What is your evidence? Your evidence is, what is your proof? How do you know that that problem, that patient is experiencing that problem? It's like you're in the courts. How do you know that that person is complaining of that problem? Instead of making assumptions. All right? Now that is where you will now think to yourself, what are you seeing? What are you hearing? What can you assess from the patient? So your evidence in that case is that this person is reporting to you verbally that they are in pain and they are experiencing facial grimacing, that they are in pain. All right? So if we were to break this down from this to this, we are looking at problems related to as evidenced by. Always remember, what is the problem? What is it related to? And what is your evidence? All right. So if we were to break it down, it is that acute pain is the problem related to what? Tissue injury as evidence by what? What is your proof? Your proof is that the patient has complained to you and you can equally observe facial grimacing. Simple. So in order to write nursing diagnosis properly, it is for you to see your patient as an individual and pay attention to them. Now, if it is in an exam, you need to understand that disease in the first place, the disorder in the first place. You need to have studied it before you can be able to understand, or before you can be able to write properly your nursing diagnosis. All right? So that's just it. Now, if you were to look here, this is a bonus point, very important bonus point. If you were to look here, you see something like risk for infection related to surgical incision. This is another example, but this is a key one, all right? This is a bonus. Whenever it is a risk, if you were to start with risk for, it means that you have no evidence. This is something that you are expecting would happen. That is, you're expecting this problem to happen. Risks for infection. Okay, what do you think can cause the risk for infection? That's where you now write your related to. Risk for infection related to surgical incision. Do you have an evidence? Not at all. There is no evidence because it is still a risk. So if you're asked to write this, risk, if you are writing a risk, risk for hypertension, risk for, difficulty breathing, things like that, make sure that you do not write evidence because there is no evidence that it's just a risk. You're anticipating it as a nurse. But if you are certain of a problem like acute pain, it means that at the end of the day, you should tell us what is related to, that is the cause, and your proof as evidenced by there. So this is the cheat code to understanding nursing diagnosis. If you enjoyed this video and you learned something, I want you to smash the like button, give me a comment, and follow me. If you are seeing me on YouTube, subscribe. If you are not seeing me on YouTube, go to my YouTube channel and subscribe. All right? So share this video to as many of your colleagues as possible. All right? I really appreciate it. I am Nurse Jonathan, and my job is to shape the future of healthcare through knowledge.